Hello and a very, very good evening to you, and welcome to our continuation of our Dean's webinars. And it's a delight to have you with us here this evening. I know the sun is shining and in lockdown has been lifted in south of the border as well. So I know the temptation is to go outside into a beer garden and partake of something nice, but it's a delight to have you here. And the topic we're discussing today, I think, is very pertinent. It's something that's certainly been brought home to myself on a personal level as well. But when I speak to colleagues, both junior colleagues, undergraduates, postgraduates, and actually senior members of the profession as well, around about our health, whether that be physical health or indeed mental health, our well-being, and just generally looking after ourselves. The panel tonight, I'm delighted to have with us today is a fantastic panel who are hopefully going to answer some of your questions in that today. So I'm going to go around the panel and I'll ask them to introduce themselves to you. So I'd like to introduce, first of all, Ros McMullen. Ros, very, very good evening to you.
Hello, good evening, and thank you for having me. Yeah, I'm Ros McMullen, retired consultant orthodontist as my day job. I'm chair of Probing Stress in Dentistry in Northern Ireland and an immediate past president of the BDA. When I was in post, I was involved a lot in trust governance audit. I was an appraiser and a mentor. I was secretary to the audit committee of the BOS, British Orthodontic Society, and I chaired the hospital training committee of the Northern Ireland Deanery for about 9 years. On the wellbeing side, I established Probing Stress in Dentistry in Northern Ireland, which is a working group which works to, it's multidisciplinary, it's been very powerful, multi-agency, and we work to raise the awareness of mental well-being in the dental workforce in Northern Ireland. I continue to work on wellbeing in dentistry in the BDA, and I'm was part of the collaboration which has developed the resource support for dentalteams.org, which I'm sure we'll talk about, and I'm co-chair with Fiona of the Mental Health Dental Working Group, developing a framework for mental health first aiders in the dental workplace. So thank you for having me tonight.
Thank you, Ros. Thank you very much. And a brilliant segue to Fiona Ellwood. Very good evening to you.
Thank you. And thank you very much for inviting me to join the Dean's meeting tonight. I'm a dental care professional, a registered dental care professional of many years experience and wear a number of hats in the field. I'm very proud to be on the Interim Education Advisory Board for the Royal College of Edinburgh and also the DCP board. I have been involved in wellbeing for quite some time. I'm a trained and practicing mentor and part of Dental Mentors UK, and I'm also the president of the Society of British Dental Nurses and the recently past vice president of the British Society of Dental Hygiene and Therapy. I write prolifically for a number of journals. In line with mental health and well-being, as Ros mentioned, I've been working on an initiative which is across 4 nations, which is looking at bringing a framework into the workplace, calling for mental health leads in every setting, which so far has been greatly received by everybody and great support from the panel here tonight as well. So that's me. Thank you very much.
Thank you, Fiona. A very good, warm welcome to you. Janine Brooks, very good evening.
Good evening, Andrew. Thank you. And again, thank you for the invite. I'm sort of representing FGDP UK stroke the new college. My background in dentistry, clinician, but then moved out into more national things. So currently I'm a trustee of the Dentist Health Support Trust. But most of my work now is around coaching, mentoring, tutoring, around professionalism and ethics. I do privately coach and mentor quite a number of dental professionals with health issues and performance issues as well. I'm co-founder of Dental Coaching Academy and the Dental Mentors UK, and I'm an associate for the GDC, both educationally and registration panelist. So thank you very much for the invite for this evening.
Thank you, Janine. A very, very good evening to you as well. Scarlett McNally, it's a delight to see you from the Royal College of Surgeons of England. Daniel in the Lions Den being a non-dentist, but very, very welcome indeed as well. Scarlett.
Well, thank you. It's a pleasure to be here. My name's Scarlett McNally. I'm a consultant orthopaedic surgeon and a council member of the Royal College of Surgeons of England. So I'm representing the Faculty of Dental Surgery today. Now, I've previously been Director of Medical Education at my trust. I've also previously been an investigator on behalf of the trust for 4 different alleged bullies within the trust, and had to run the whole investigation program, because my kind of 2 directions really are, one around people living their best lives. I'm also Deputy Director for the Centre for Perioperative Care, that's cpoc.org.uk, trying to get people through surgery better, so preparing for surgery, having good shared decision making and good care afterwards. So there's that. I was lead for an Academy of Medical Royal Colleges document, I'm going to show it there, Exercise, the Miracle Cure, about just the impact that exercise can have on people's mental health and physical health, that we need to embrace as practitioners. And I've also, with the Royal College of Surgeons, and as I said, in my own trust, been working, this is something I did for the Royal College of Surgeons of England, avoiding unconscious bias, but actually it was about how to avoid bad behaviours in the workplace, people saying things they didn't mean to say, interpersonal relationships that can cause such distress to individuals within the working environment. So, and in fact, the Royal College of Surgeons of England brought out something this week on avoiding disruptive behaviours. So if people are behaving badly within the workplace, having clear standards of what to do about it. I know many colleges and the Association of Anaesthetists have brought out good stuff. So from my point of view, it's about everybody knowing, living their best lives, exercise, nutrition, getting sleep, all those kind of things that are so important for all humans. None of us are immune. And also the interpersonal working relations, trying to make sure they're as good as they can be. So thank you so much for the invitation. Thank you.
Thanks for that, Scarlett. Yeah, I'm sure we'll certainly touch on quite a lot of these topics, I think, this evening as well. I think we've already got a few questions around about that as well. It's a Dean's webinar, so without a Dean's webinar, I need some Deans besides myself. So it's a very warm welcome again to Philip Taylor and Albert Young. Phil.
Thank you. My name's Philip Taylor. I'm currently the Dean of the Faculty of Dental Surgery of the Royal College of Surgeons of Edinburgh. I started my dental career in dental practice, 12 years in practice as a associate and practice owner and VT trainer at one time or another, then decided I got bored and went into hospital practice and became a consultant in restorative dentistry and latterly Professor of Prosthodontics at Queen Mary University of London. I'm now retired. Part of my job when I was there, though, was that I was clinical director for dentistry, OMFS, and strangely ophthalmology, which meant I had over 74 consultants to look after, which led me to believe that we may have some issues in the workplace. Fortunately, one of the things about the Royal College of Surgeons of Edinburgh is that we've had an anti-bullying campaign for quite some time. And one of the things that I managed to do just before I left, and as I said just before we started the webinar, that my leaving present to Barts was 13 psychiatrists. This wasn't actually for the members of staff, though it did end up that way. They were meant to be to help the patients in all of the 13 specialties within dentistry. I'll not say which one of the specialties I thought needed it most. I think the key bit of that was that actually it worked out really well because of COVID, because all of those psychiatrists have stayed with us and actually have been helping with the staff from the front desk right through the nurses, through the hygienists, through the therapists, and not last but not least the dentists as well. So it's something that's been at the heart of work that I've been doing for quite some time. So thank you.
Thanks for that, Phil. Last but certainly not least is my good friend Albert. Albert Love.
Thank you very much, Andy. Thank you for having me again. This is the second cycle of the Dean's Seminars, which started the month after COVID started last year. I'm delighted to be here again. I'm Albert Leung, the Dean of the Faculty of Dentistry of the Royal College of Surgeons in Ireland. My day job, I'm the Professor of Dental Education at UCL Eastman Dental Institute. And one of my job and task is to be a personal academic tutor for the students at the Eastman. And we look after many aspects of the well-being, welfare, career and challenges that students and everybody faces. So it is a very important topic that we are discussing today in relation to the well-being of everybody. I'll be looking forward to everybody's input. Thank you very much.
Thanks for that, Albert. Yes, you're absolutely right. There's a lot to touch on this evening, and it's, as I say, I want it to be an interactive webinar, so please feel free to put your questions to the panel in the chat box in and around well-being, mental health, physical health, and indeed any issues at all which you think are pertinent, and we'll try and discuss them or indeed touch on them. I'm going to start off with a generic question. It sort of came in earlier on this week to me here, and I'm going to throw this to Ros to begin with. And it's about what sort of mental health issues are we seeing? Is COVID an excuse? Have they always been there in dentistry? And maybe COVID's been looked at as an excuse, or is indeed COVID highlighted a lot more of pertinent issues, particularly in certain areas of mental health?
Thank you, Andy. It's a very interesting question. Just want to roll back a little bit about terminology. I think it's really important that we separate mental health issues from stress and burnout. Stress and burnout are relatively common in society, common in our profession and in healthcare. And most people who suffer stress and burnout recover well with good professional networks and usually without professional help. Obviously, if you are stressed and burnout and you have an underlying mental health issue, which would be mood disorders, addiction disorders, and then the more severe, less common, such as bipolar, schizophrenia, then of course that can adversely impact upon an underlying mental health issue. Going back to your question, it's an interesting question, Andy, because what we know is largely by surveys, so we don't tend to have really good evidence on this, but we do have good survey evidence, and by chance we had some good surveys done pre-COVID, and the same questions were then asked post-COVID, and things like psychological distress was measured. And interestingly, well, first of all, you'll not be surprised to hear that pre-COVID, the survey results were fairly high. Survey results tend to be high anyway, higher than the general population. So if I go out and ask teachers, go out and ask doctors, go out and ask policemen, are they stressed, that they generally come back with fairly high indicators of that. But we do seem to punch above our weights. GDP is the highest, community dentists not far behind, and then hospital dentists and academia. So all fairly punching above their weight. When you looked, and we could talk about the reasons that they're stressors if you want further on down, but in specific relation to your question about COVID, the same survey was done early on and these were done by the BDA, by their research unit there, and published in the BDJ at the beginning of this year. And it was the same questions were asked early on in the first lockdown. And interestingly, overall, the stress indicators went down slightly. It was interesting. For some, the stress increased. It was more likely if you were in England, if you were a practice owner, your stress increased. Now, this was early on in the lockdown. It was probably before the PPE issues kicked in and SOPs appeared and guidelines appeared. But there was, people quoted financial worries, threat of clawback in England of contract payments, worries about bankruptcy, the need to take out loans or mortgage on their own personal assets, balancing homeschooling and professional responsibilities. So we had the issues that affect the general population, and there was a feeling of being let down. But for some, they reported their stress reduced because it was a chance to get off the treadmill. It was a chance to reevaluate their life, their life goals, and they really appreciated that time. That could be interesting for manpower issues going down the line, but interesting, and it'll be very interesting to see how those indicators change as we go through the pandemic with what we know about pandemics and well-being.
Thanks, Ros. These are very pertinent observations and stuff like that. And it's great that we have some sort of pre-COVID data, although be it through a survey and that, so we can compare and contrast as well. Janine, I'm just going to bring you in as well. If you've seen a lot of, particularly in primary care, have you seen a significant increase in, Ros alluded to, rather than mental health where we deal with depression, but things like stress, because obviously the stressors are a lot more possibly within the, and Ros mentioned community dental services in particular.
I guess two things there really, Andrew. We have got figures from the Dentist Health Support Trust about the numbers of dentists who actually come there for advice and treatment and their diagnoses. And what I can tell you in the last quarter, the figures, the largest number of people were coming for mood disorders. Mood disorders gone up tremendously. It's something like over 60% now of those that are presenting with mood disorders. I mean, as you know, Dentist Health Support Trust looks at both mental health issues, substance and alcohol misuse. But substance and alcohol misuse are now falling behind mood disorders and other type of psychiatric type disorders. So there are some figures there, but clearly they're small numbers, because those, if you like, are the tip of the iceberg, and perhaps the more serious cases coming there. But there's a few figures. But I think what Ros touched on, and what I've been particularly interested in over COVID, is if you look at indicators of well-being. I was interested in the Care Act 2014, and that gives a number of factors that underpin well-being. Clearly physical and mental health are one of them, but you've got things like control by the individual over their day-to-day life. Well, for dentists and other dental professionals, that was almost the one thing that people went into the profession for. You had control. Well, that went overnight in a group of people that we would never have expected that to happen to. So that was a big issue for a lot of people. Then there was the whole participation in work, education, training or recreation, gone virtually overnight. Another massive thing that we all took for granted. Domestic, family and personal domains. And that was suddenly, they were worried about themselves, they were worried about their family, their parents. That was something that was again new. So the whole domestic thing changed around. And also the individual's contribution to society. Suddenly, we weren't contributing in the way that we had done. And in fact, a lot of dental professionals contributed massively on the front line, but we didn't hear much about it. And so there was sort of that little frisson that went on there. So I think if you look at what makes up well-being, what, if you like, underpins mental health issues and what is upstream of mental health issues, that's what COVID gave us. It gave us so many more factors beyond what we'd got before. And yeah, I've been working with dental professionals who have said, this is it, I've had enough. I'm not interested in this anymore. I want to look at other career options. I want to do other things. I've had enough. This is the straw that broke the camel's back. But there is, again, I think Ros indicated this, there is also been some real opportunities, and many of the profession actually stepped into those opportunities and did and are doing amazing work. And we are beginning to see, you know, that when it came to moving into hospitals and helping, you know, there was nobody like the dental professionals who knew about PPE and actually how to do it properly. And many of the doctors and nurses were left sort of, oh, right, okay, you do it like that. Well, yeah, we do this every day. So, you know, they stepped up to the mark. The vaccination program stepped up to the mark. So actually, our profession has shown itself proud, but we have to bear in mind that there are a lot that are really, really struggling. I mean, financially, you would never have imagined of finding a dental professional under Waterloo Bridge sleeping rough. Well, you could have done possibly after COVID, because some people lost an awful lot of financial stability. So anyway, I'll shut up now and let a few other people get in there.
Janine, thanks for these observations and reflections. Interesting point, you mentioned that somebody's put their hand up and said, I've had enough, and I'm going to bring Fiona in here. A lot of people will not do that though, Fiona. So what are the sort of things that we can look out for? I mean, I'm a surgeon, Scarlett's a surgeon, you know, we're meant to be tough and, you know, we shouldn't show ourselves or anything like that. We just get on with it, bite the bullet or anything. What are the sort of signs that we might be showing, or we can pick up on colleagues, or what should we be worried about basically? Because sometimes we just don't do it and stick our hands up and say, right, I've had enough, I'm out of here basically.
Thank you. That's a really interesting question to ask, and a huge question actually. I think the answer could take all night, but I'll try and keep it quite narrow. I think one of the things we need to be mindful is that it doesn't matter who you are, what rank you are, what skills and qualifications you've got in this. Actually, we can all hit that point at some point if we don't look after self, and looking after self is enormous. But look around to colleagues as well, because your colleagues who work with you day in, day out will recognise the differences in you. You know, there are as many, if I refer to the dental nurse as an example, they know their clinicians, they know what they normally do, they know when they're having a bad day, and they know that bad day is something other than a bad day. What we really lack is that joined up thinking, in that dental nurse could then go to somebody and say, I'm really concerned about my clinician. And we've not had that joined up thinking. We've had a huge void here. We need to have conversations and learn how to have conversations so they're not difficult conversations, in order that those topics can be approached easily and that they become part of staff meetings, inductions, appraisals, all of the mechanisms that we have in place anyway. We just don't use them very well, in order that we can pick this up and stop it early. And part of the work that is the framework that Ros and I and DPA have been, the Dental Professional Alliance have been working on, talks about early intervention and safe signposting. And it's about noticing those very early signs. We all have bad days and good days, and you know that they happen in life. We're human beings, but actually things build up, and if we don't know how to put in strategies to deal with these things and to turn to others and be able to speak, then we will overflow. And if you've ever met the stress bucket, or if you haven't met the stress bucket, you need to look at it. It's a great pictogram, if you like, that demonstrates very easily on how stresses can build up. And I think, as Ros pointed out, there's a huge difference, and I've written a paper recently, hasn't been published yet, but it makes that academic leak as to what the difference is between stress and mental health, but how stress can actually push that bit into mental health. So back to the point about, you know, signs, and you know, it's easy to see the signs actually when you notice somebody's different, but about being irritable, about not sleeping, about not eating, not doing the things that you would normally do, you know, being irrational, not making good decisions. They're all things that we pick up on, but in self we don't recognize them, and sometimes we can try and cope and we think we're coping, but actually we're not. And when things really go wrong, if they're left to escalate, somebody will eventually turn around and say, well, I thought that was a bit odd. Oh, actually, I noticed that, but I didn't like to say. And that's what we need to unpick, is why can't we have those conversations? Why don't we have that space to have those conversations? And what would make it easier? And that's why we'd like to see the leads in the workspace, so that we have got the opportunity, whether it's through post-its on a board, you don't have to name them, but you know, whether you need the discussion point, whether you need to take the time to go for a walk at lunchtime, you know, you need to gather that time that is your time, that nobody interrupts. And I was always taught the hardest word to learn is no. Actually, I'm quite good at no. And people don't always like that response, but you have to stop. You have to have protected time. You have to know how to deal with things, and you have to learn to delegate. You don't have to be that expert and that go-to person for everything and everybody. And the sooner we all learn that, the easier our lives will be. So I'll leave that one there, Andy, in case I go off onto another track.
No, that's fantastic, Fiona. Yes, yeah, I think what's got coming out of that is having the conversation, whether it be with yourself or another. I'm going to bring Scarlett in here because obviously we're talking a bit about, you mentioned the word coping and stuff like that. And Scarlett, you've done quite a bit of work round about, you know, the physical aspect of yourself, basically, which can actually influence the stress or the mental aspect.
Thank you. Yeah, and I'd really like to echo the document that Fiona and Ross have just shown me is really, really good. This framework around mental health and well-being, it's really good, and it sets out what needs to happen, and it's the awareness. And in terms of in the workplace, where I've been exposed to difficulty, people don't realize what they're saying and they lash out or say something they didn't mean to say. And sometimes the processes almost make it worse because people want to go through a bullying investigation, and actually what they need is someone to say, are you okay? Because it's often there's something else that's going on that is just taking over and they can't make good decisions, as Fiona was saying. And often you don't want to just have that adversarial approach to it. Often it needs someone just to take them aside, away from the patient, and just settle things. So the first aid for mental health is just so very important. And thanks for bringing up about the work on exercise and things. I mean, in my view, as surgeons, and I assume across the dental professions as well, there's this idea that you have to be the best, you have to be perfect, you have to keep going, you have to get the exams, and you know everything is critical, and you don't want to make a mistake and all that kind of stuff. And actually we're all human, and we kind of forget that. We're almost trained and selected to forget that. And people need to really relearn that, you know, it's important that going out for a walk, taking some time out, getting enough sleep, knowing when to alternate an alcohol drink with another. And the work I've been involved in is around exercise, that the World Health Organization recommends between 150 and 300 minutes a week of exercise to keep your mental and physical health. And that's quite a lot. That's 21 minutes a day or to 40 minutes a day. It's quite a lot to squeeze in that amount of exercise. And, you know, but you need to factor it in because you're human. That's how your body works. That's how your mind works. And a lot of us don't. So it's kind of almost paring back and working out what you need to fit in. And interestingly, on a tangent, I was quite pleased when the lockdown restrictions started, the very first time they started, that the idea you should go out for an hour of exercise every day was allowed, permitted and encouraged. And I'm so pleased that that happened. I mean, there are other things I've done differently, and some people are in a worse health state because they've been shielding and feeling they've been stuck indoors for a year. But these things are just so important, and it's particularly being outdoors in the fresh air, ideally interacting with other people. There's all sorts of things that as humans we need, and a number of people just get so stuck in their work that they just forget they're human. But yeah, it's probably enough for me.
Thanks for that, Phil. You were chatting earlier, and Phil was, he was a clinical director of 30 odd consultants and stuff like that. Once the higher up you go in the profession, whether it be in the dental profession, surgical profession, sometimes you hide your light under a bushel. I don't know, did anybody come forward with you in confidence, or while you were dealing with it, or again was it very much not talked about, basically? And as Fiona said, is having that conversation.
I think what was interesting, is how the team actually gelled together even more than usual. I think it became more obvious that there were teams, in the proper definition of teams, and they believed in each other and they supported each other. And it went more than just a group of dental consultants. It was the whole thing. what it did break down, and it wasn't bad where I worked, fortunately, but it broke down the barriers between the trust and the schools, and that is actually quite a big issue. That division between the academic part of training young dentists and the trust requirements was always a little bit of a friction point, but actually it seemed to disappear. And I think a really good point was made about the dentists, and particularly the nurses, who went into places like A&E, and they were maternity. It was a good job they didn't send me there, I think. We could have had all sorts of problems. But the good thing was that these people just went in after a few days of them feeling quite snubbed, and they came back to me with that as their first response was, they don't really think we can do this. My response was, just go and show them, and they did. And they turned around, and these people actually then realized how powerful people who hadn't been trained in their specific fields really were. And I think that's been an important thing. And I think it's set up, certainly within the dental hospitals, I think it's set up a situation where the respect for dentistry has improved quite considerably. And I think that's something we can take from it. That I'm always the person who's looking for a positive in something, and I think there are some positives in that. I think that's something we can take away from it. I think a bigger problem, and I know we've talked about this in other ones, is what's going to happen with our waiting lists now, and the stress that's going to happen for dentists, particularly in hospital, to try and deal with those waiting lists, which are enormous. And I'm sorry, Scarlett, but the orthopaedic juggernaut, as I call it, will be wanting to take over all the theatres, and it makes it very, very difficult for dentistry, which is not regarded particularly highly for that point of view, to get space. And then we get hammered because we can't manage our children's waiting lists, and we get hammered because we can't manage our oral surgery waiting lists.
No, it's right. As I say, it's interesting. Just as I alluded to earlier, I came off a business meeting with my senior business manager, and we were talking about my waiting list and how many thousands of patients I have. And I was looking through when my next new patient clinic was going to be for a new patient that was referred to me today, and I seen August, and I thought, well, that's not too bad. No, that's August 2022. So that my stress levels went through the roof, and then he said, you've got a waiting list of 3,500 patients, and I'm thinking, how am I going to cope, basically? So I went and done what Scarlett said. I went out for a walk for 15 minutes before I knew came back here, and I felt very much refreshed. Albert, we've talked a lot about individuals, and my thoughts really are around about our trainees and stuff like that as well, about how it's impacted on them. Undergraduates particularly, and what have you seen yourself regarding the undergraduates who've been through so much, and particularly north of the border, we're having the training extended?
Yeah, thank you, Andy. It's a fascinating questions on it. My experience seeing either the senior undergraduates or that colleagues who are undergoing early postgraduate trainings, I find that a lot of them coming from the generations where they have not had any variations or failure from their experience of career to date. They have always had everything completely smooth. The path to university is smooth, graduation was smooth, into training was smooth. So when COVID or anything related to that hit, there were a lot of uncertainties, a lot of challenges, which was unprecedented because they never expected things like that. And some colleagues come off it very, very badly because they never know what to expect. All they have experienced so far is huge success. They can plan 2 or 3 or 4 years ahead. That's where we're going to be. And all of a sudden, for very obvious reason, that was taken away because it was never possible. So the sense of hopelessness that we see sometimes, and inability to cope. So the typical problem there is that we have quite a few of general dentists getting trained part-time as well. And they get a double whammy that their jobs were very, very insecure all of a sudden. And they are facing with all these uncertainties and money worries, etc., etc., etc. And at the same time, when they are training, they are asked to pay fees, say we can't afford to pay. And then they say, oh, we'll fall in foul with the regulations, and they get warning letter and all the rest of it. So it is very, very difficult coming in this situation. That's not in isolation. But what I find is that some colleagues actually manage it far better than others. Perhaps it's something to do with resilience. I don't really know as such, but some would go very, very quiet, in my experience with it, and they wouldn't say it very much. And you know that, oh, there's something wrong there. It's not quite good. The mood is not very good. One of our colleagues saying that mood disorder, completely agree with it. And then it looks and feels like that the control over the life is gone. It's destroyed, some of them. It is very, very difficult, in my opinion, to manage and handle, because you get a significant minority who would think that that's okay, I can cope, because I've never experienced things like this before, I can cope with it. But the actual fact is that it is not. They need to be encouraged to come in and seek help, and to seek at least somebody to talk to. Very often I find that the approach that we see is a very adversarial approach, where they say, oh, we've done something wrong, therefore, oh, this is not quite right, and therefore, is not quite the type and the kind of approach at this particular moment in time, because what we face is something very, very different. So I find that it's something that if you give them some of the space to talk it over, it doesn't have to be very, very complicated. Some of them would say that, yes, they would formally like to seek help, but some even refuse to say that there is a big problem. And the trouble is that if you refuse to say that, oh, potentially there's a problem, you don't know what you don't know, and that can spiral downhill. And we've seen some cases like this, unfortunately, not doing too well. So coming on to that there, that it's for colleagues and staff and others to try to support these particular problems, which are not easy, because a lot of them goes into remote learning mode. You see them in Teams, you see them in Zoom. You don't actually physically see them. So a lot of things are missed. You don't know. They miss a session. Oh, is that because the internet went down? Is it because something else goes wrong? Very, very difficult to say. So in other words, I think the mentors, the teachers, and colleagues there acts as a buffer to see from the experience, from the resilience, from the life, what they can actually do in a non-judgmental fashion, talk things over. Sometimes that if you let, I mean, that's my humble experience, if you let them come in very, very slowly, it will come up with a very, very small trickle. And then after a little while there, it's just like the tap opening, you see all the different problems. And that's the business end of time. You think that there may be things that you can help, there may be things that you cannot help. It's very, very difficult on that in this experience. So a very, very smooth approach if possible. I know for a fact that colleges, Royal Colleges, as well as university are generally very, very helpful in helping to ameliorate a lot of the circumstances, extending some of the trainings, allowing some fee deferrals, allowing different equivalents to be considered with the same learning outcome, so that things are not that bad, not that great in that particular area, to try to improve the outlooks on it. But it is difficult at the end of the day for us to be able to say and tell, yes, this is what's going to happen tomorrow, because we generally don't know what's going to happen tomorrow. And it is this uncertainty that you slowly build it in, and how you use the background in this uncertainty, that you have got some certainty that we try to help you in that sense, that I think makes a lot of difference. The regret of it is that despite best effort, that we're not successful in all the cases. Some that do better than others as such. I think that's something that personally there's a lot to learn from, in this respect, and learn from career, learn from outlook, and learn from other things, learn of how you look at things, how your personal outlook is in developing that emotional quotient, deep resilience, and this confidence in oneself that yes, things will turn out to be okay at the end of the day. Thank you.
Thanks, Albert. It's interesting. You mentioned a couple of things that I picked up on. I'm probably bring Ros and maybe Fiona here and touch on. You mentioned resilience, and then you mentioned if it starts to spiral out of control. And we do see, and I'm talking about, you know, the consequences of it. I think, Ros, like alcohol, drug abuse, self-harm, suicide? Do we know that the rates of suicide have gone up, or do we know if alcohol and drug abuse has gone up over the last year, Ros? I don't know, but has your study managed to tease that out at all?
We don't know those facts. One of the big issues around here is the data gathering, and I put a plea out there to get that we need to get accurate data, not just of dentists, but the whole dental team. We really need to get the accurate data. Again, pre-COVID, obviously suicide is the end of the continuum. But there is a lot of misconception about suicidal thoughts and dentists. So in the general population in a lifetime, 20% of the population will have suicidal thoughts, so really quite high. I hasten to add that most people do not go on to self-harm. That's really important. And if you look at dentists, it's actually 17.5%. So in a lifetime, so actually no statistical difference. What is different in dentists, it appears to be that within a 12-month period, they think about it twice as often. So within a 12-month period, the average population is about 5%, but within dentists, it's 10%. So maybe it's the same group of people, but thinking about it more often. What I would like to talk about a little bit is hope. And it's really important that we have hope for the future, because things will get better. And it's really important that we have that reassurance that this will be a time of difficulty. Obviously our whole society is going through a time of great difficulty. But we have to have hope that things will get better in the future. We can reach out to the public we serve. And lastly, I'd want to make a plea for another set of colleagues, which is occupational health. Occupational health has become a bit of a Cinderella, and I too was a clinical lead of a large group of clinicians. And the view on occupational health was that it was well, first of all, it suffered from multiple cuts. When cuts came along, they seemed to really get it pretty hard. But also the perception was that you went to occupational health for either your Hep B or it was an HR issue. And occupational health has they have skills and an important role to play in that prevention. And as we deal with the backlog, as we deal with those waiting lists for our general practitioner colleagues, as they try to deal with the backlog of work that needs done, as our teams support them, that occupational health needs to be with those skills, bringing those skills and building prevention into the workplace. And that they really need to be given that funding and that support to bring their skills into the workplace, and not be that perception that it's somewhere you're sent when you're bored, or you've been off too long, or there's a bit of a problem, and they're stuck in some porta cabin in the corner of the hospital. So yes, we're all nodding. We all have that. So I would make a plea for bringing the skills that occupational health can bring into the workplace in the prevention. Thank you.
Thanks, Ros. Fiona, I mean, Ros has alluded to occupational health. Is there any other signposting that we can do for our colleagues? In the hospital, we do have the porta cabin in the corner of the car park, as they say, and as I say, it has been looked at as a Cinderella profession. You know, people say go to occupational health, but I'm just thinking for people, possibly general dental practitioners who may not have access to that as well, what's available for them as an individual, or indeed, you know, as within a dental practice, to signpost them?
I think that's probably quite a poignant question to throw at me, actually, because there are quite a few, I should say, signposting that we can do for dental practitioners. And you know, Ros has been part of developing the framework, the collective document, which has got the signposting in. Janine's part of it, of a group that actually delivers that as well. But when you look at dental care professionals in a primary care setting, that is not as easy as it is in secondary care. And even in secondary care, I think I might be brave enough to say that it could be patchy. And people also have to be brave enough to reach out themselves. It's not always the other way around. So part of the work that we've been doing is because there isn't that reach for the whole team, not readily, other than going to the GP. And then we get into the problems where it could be really looked at with stigma around it and the difficulties we all have with mental health and the way it's portrayed by society. And we need to move away from that as well. So there are resources out there, they're plentiful. They're reliant on the person understanding that they have a problem. And when it's classed as a problem, it then becomes a greater difficulty. So I think that what we really should be saying as a profession is, looking back already, and we're not through this in totality, is what have we learned from this, and where are the gaps? Because there are huge gaps in different areas of dentistry. But when we look at mental health and well-being, where could we have done more? What could we have had in place? What have other sectors done that's been successful? Because that's been really part of the work that we have done on the mental health framework, is we've looked to other sectors as well and said, what have you got in place? I have to say that we have presented gratefully to the councils, but we've also talked within the NHS, and I've been invited. I haven't actually told Ros this yet, but I was on another call today. It was completely different to dentistry. And another society has picked up and said, would we speak to them? We never seem to move away from that because the framework has been so welcomed. So going back to dentistry in primary care settings for the dental care professional, I would say it is quite difficult. And remember that not all areas have occupational health as well. So, we do need to look out for the whole team. I'm sure that, Ros would share the document and the link to the document, and Janine again remind you of the support network that she's involved with. But let's not forget the whole team.
Thanks for that, Fiona, and we'll probably bring Janine in. She's probably got there. So, there's a lot of learns, I think, really over the last year, isn't there? And as you mentioned, there's been a lot of holes and gaps in where we can do, and we've learned a lot as well. And I suspect you maybe found that, Janine, probably in your reflections and stuff like that over the last year.
Yeah, two areas particularly. I'll pick up for Albert on foundation trainees, not undergraduates, but foundation trainees, and with Fiona for the whole team. Practitioner health is available for the whole dental team across the UK. It may not be that well known as it might be, but practitioner health, Claire Gerarda, who is the director there, confirmed earlier this week that practitioner health is available for the whole dental team, which is great because obviously that's expanded now out beyond London. As regards foundation trainees and core trainees, they are able to find support and coaching support from the professional support and wellbeing units that are within Health Education England, and they are there, as I say, just for trainees. So that's doctors and dentists, but they are trainees. So for us, that's just foundation trainees and core trainees, but they can access that support, and there is specialist mental health support that they can access within that as well. Their TPD or their trainee can make the referral, or they can make a referral themselves, and they can have that support, which is great. Dentist Health Support Trust, yep, there for individuals and their families. Only dentists. We've had endless debates about extending this for DCPs, but at the moment that is only dentists. Confidential, as you'll know, is a helpline where dentists run for dentists and can give immediate emotional support, and they are trained in mental health toolkit. There is the How Are You Feeling toolkit that has been set up by, again, NHS England, which helps people understand emotional health and access on emotional well-being. And NHS employers have got an emotional well-being kit that can support staff and individuals who are going through problems. Then, of course, we've got the generic things like Mind, Samaritans. Let's not forget about domestic violence here. That is something that has actually increased during COVID, and unfortunately, dentistry is not to one side of that. So there have been issues around domestic violence for dental professionals and the involvement there. In fact, I'm supporting 2 now that are going through GDC proceedings because, as you know, police cautions, the GDC gets to know, and then they end up with a referral for that. And they usually go to practice committees, even though people don't always know that. So we need to watch it. So there are quite a lot of support. I think the issue, to be honest, Andrew, is that people just don't really know about it. So I mean, getting that out there, about the word, about all these great things that are happening, and the work now that Ros and Fiona are going, I think possibly could crack that really hard nut about getting out into the workplaces and getting people to know that there are these resources available to them.
Can I make one point, Andy? Sorry. And all those things Janine has talked about, and the one-stop shop for all of that is www.supportfordentists.org. That is the website. All of that stuff, the whole of the UK and for the whole team is there. So www.supportfordentists.org, and that's where it's at.
Excellent.
Yeah, thanks. That's it. There is a plethora of information out there, as I say, and it's just making it available to people and getting that message out there that, you know, people don't need to feel alone here. There is that support network. Scarlett, I'm going to bring you in, and it's a question that came in around about a trainee and trainees, and obviously you'll have trainees as well, whether they be dental trainees or orthopaedic trainees, and they felt guilty about not taking time off or anything like that. They were studying for their examinations, they were going for their FRCS exit examination, and with COVID, they just, you know, the stress of everything, they just felt guilty. I don't know if you found that with your trainees. They feel pressurized in that to do anything, and they feel guilty if they take time off to actually go and have that 10-minute walk. I don't know. As I say, it was just a question it came in.
Thank you. I think people set very high expectations of themselves. As Albert was saying, people have an expectation they'll be able to achieve and thrive and hit the milestones all at the right point. And yeah, so guilt is an emotion people feel if they can't achieve what they think they ought to be able to achieve. But then there are other things people try and keep trying and just fail and don't realize they've got a problem. And all sorts of other ways it can come out around how they deal with their families, deal with the rest of their time, and all that sort of thing. And as I said before, I think we're not very good as professionals in acknowledging that we're also human, and we need to fit that in. I've been doing work with the Royal College of Surgeons of England for many years with the Women in Surgery programme, and it should be for all parents in surgery that there are certain times in life where you need to put time into one aspect of your life as well as into your training. And you know, we should have shared parental leave, for example, but it's similar if you're being overstretched in your clinical work and you also feel pressure to get through the exams and academic progression, and also your family time. It's really, really tough for people, and it can come out in all different ways. So yeah, we need to look after people, and we need to notice when they've got a problem, and just a little bit. We can't solve everybody's problem, but we can notice, and we can try and be nice as well, not just assuming why people are behaving in the way they're behaving, but just asking if they're okay as the first step.
it's taking that first step sometime as well. And I'm speaking of steps, I'm conscious of the time, so I'm going to just go around the panel and ask them. We didn't have enough time to explore coping strategies, how we deal with it and stuff, but I just want to hear it, individual thoughts or reflections on how you would deal. Or, I mean, my coping strategy is to say I was a bit stressed out after a meeting there, and I went out 10 minutes, 15-minute walk. Luckily, I live out in the country. It was great. There's sheep in the field and lambs, and I came back. I felt refreshed, and I thought, right, excellent. And I knew I had a wonderful webinar to do tonight as well. So, Phil, what sort of coping mechanisms you do? And we don't want to hear about alcohol or drugs or anything like that at all, basically.
Actually, funnily enough, alcohol isn't a coping strategy for me. I'm very self-reflective, and I do like to sit in silence and think about things. I'm not one of those people who there was a very popular time, certainly with the VT training, where they wanted you to write everything down. Now, I hated that with a vengeance. I always used to think that was like my mummy's first haircut or something. That's not the way that I felt that worked for me. For me, it was self-reflection and sitting down and dealing with it myself. Although I'm one of those people who beats myself up all the time, I'm never good enough, and I find that very difficult. And I've had to learn, partly because of the school I went to as well, where there was an expectation that you could not fail, and I think that was a bit of a problem. But I've learned, and it's taken me a long time. I'm an old man now, and it's taken me about that long to work out how to deal with it for myself.
Don't be silly. Age has got a number. That's what I always say. Albert, what do you do for yourself? How do you do to release the tension, deal with the pressures of work or what's getting to you?
I find that two things. One is that, like Phil, sit down quietly and have a thought about it, and try not to be judgmental and try not to be too harsh on yourself there. Because there were things, no matter how you think, you were never going to succeed. There were things that you've got a better chance of being successful. And there are chances of, depending on circumstances, how you will get there. I think if it's an impossible goal to chase, don't bother, because you're just going to disappoint yourself. And also that if you're under slight pressure or stress, go for a walk, half an hour's walk. One is stop you munching, so you will not under COVID put on weight so much if you don't eat so much on there like this. And number two, is actually good to get fresh air. The area that I live in there, before COVID, I never even thought of doing that. And I never even thought that, oh, there was some nice place that you can have a nice walk there afterwards for half an hour, three-quarters of an hour, or an hour. And after you feel refreshed, then you're much more ready to go, and you feel a lot calmer as well. That's what I try to do.
Thanks for that, Albert. Yeah, Ros, what's your sort of, I mean, if you were to say this is what I do, I mean, we know we've written the textbooks, we've done this, but what do you think? What do you do when life's getting just a bit too much and you think, right, I need 5 minutes here?
Pre-COVID, Andy, I'm a talker. So I, like Phil, I'm a bit of a half glass full person. I always did beat myself up a bit. Maybe I could have said that better. Maybe I could have done that better. So I had a couple of good sounding boards in the trust. I was very lucky. I had a cardiologist who I was very close to, an orthopedic surgeon who actually was my clinical director, and is still a really good friend and still a great sounding board. So, there are people who could listen to my rambling. So I'm a talker. And I live alone, apart from the cat. And so I really found the lockdown really very tough, and surprisingly so. I thought I was a pretty strong character, pretty self-resilient. I don't like that word, but because I thought I do like my own company, and I thought I'd be okay, but I actually missed the people. I garden. That's how I get my fresh air, and I love to watch things grow. I grow a lot from seed. I put the peas out yesterday, had to cover them all because it's so cold tonight. So they, I suppose, are my little children. But I talk, and therefore I was one of those people who struggled a little bit through the lockdowns.
Thanks, Ros, for these reflections. Fiona, what about yourself? What's your, we're running out of time, so just a couple of wee words about what you do. And, don't kick the cat or anything like that.
I don't have a cat. I'm quite fortunate. So if I'm in the office and things get too much, I'm quite good at just switching my computer and my phone off and walking away. I don't feel any guilt on doing that at all. I think if anything's that urgent, people will wait to speak. I think, you know, I've learned to master my time better through COVID and behave better towards time and having personal time. But actually, I'm very, very fortunate in that I have horses in my back garden. My horses are at home. So I can just say, okay, it's a beautiful day. I love the frost. I love to get up in the morning with a cold frost and a beautiful sunshine and go up to the yard where there's a horse who just wants his breakfast and wants to get out as fast as he can and has no manners at all when he's in that mood. But, you know, that is my release. It switches you off completely. They're the greatest leveler.
Fantastic, Fiona. Animals, yeah. I was wondering when the animals. I'm like Roz. I live alone, but I do have a cat. And as I say, I don't kick it. I actually find the cat very therapeutic. It's the only person that listens to me and sits there and looks at me. Janine, what's your little perils? What do you do?
Well, I'm a Myers-Briggs practitioner, so actually
right.
I was quite interested in what you said. And you'll see that about 70% of dentists, it's been researched, have an introvert preference. And Phil and Albert, Fiona, and I would say myself are probably all eyes. And that's where do you get your energy from? In fact, I think you are as well, Andrew. And where you get your energy from is yourself. So actually, after you've had a long day like that, having time on your own charges your batteries. I think Roz is an extrovert preference, and I think she gets her energy from people. And so actually, a lot of dentists, they found the lockdown not that hard, actually, because I had a bit of time to charge batteries, but there were some that didn't. Unfortunately, I've also got a judging preference, so that actually really, you know, it's a bit of a problem as well. You've probably never picked up on that one. I think you're right about pet therapy. Yeah, I've got 2 cats and 3 from neighbours, and you know, pets, horses, cats, dogs, I think they give you huge amount of downtime and are really therapeutic, even when they're puking on the carpet. So yeah, so go for a walk, get a horse, get a cat, and eat well, sleep well. Yeah, a bit fright, but yeah.
Thanks, Jane. Last but not least, I think I know what Scarlett says, but she's going to tell us anyway.
Thank you. I go out on an electric bike every day and it's fantastic, absolutely fantastic. Just blast everything away. I recommend electric bikes. It flattens the hills and everything. But the other thing I do, it's really nice to feel you're achieving something with other people. And we've got a cycle campaign group in Eastbourne. We're not achieving anything with the cycle lanes, but we keep banging on about it. And I try and give the kind of medical input about how important it is, reducing pollution and all that stuff. But that we've got a meeting next week. We're trying to get plans together for the summer, and it's really nice to do stuff with people and everybody and mix in. So that's it. Thank you.
Thanks, Scarlett. Yeah, focusing your attention away from the medical thing as well. And it's likewise round about where I am. All my friends are all farmers, which are fantastic, you know, and it's lambing season at the moment. So the lambs are all around and stuff. And that's a great release for me because I can go out and speak with them and we don't talk about medical talk or anything. Look, we've slightly overrun by 3 minutes, but just want to say a very big thank you to the panel this evening for some very, very frank discussion around about health, mental health, physical health, well-being, signposting, what we can do. But most importantly, I found the last 5-10 minutes there very refreshing, just getting some personal reflections from you all about how we deal with it. I mean, we're always telling other people how to deal with it and stuff, but it's quite nice to hear what you do yourself as well, and that I'm sure will be some good feedback to our attendees as well. So it's just to say a very, very huge thank you on behalf of the Deans for attending, to Scarlett, to Roz, to Fiona and Janine, and of course, obviously Phil and Albert. It wouldn't be a Dean's webinar without the Deans as well. So just wish you all a very good evening. Stay safe, stay well, stay mentally well as well, and go out for that ride on that bike. Go and see the horse, stroke that cat, but try and stay away from the alcohol, as Phil says. And thanks very much anyway. Have a very good evening. Thank you.
All the very best. Thank you very much. Thank you. Thank you. Bye-bye.